We save lives. We have been on a journey for more than 30 years to prevent mother-to-child transmission, to provide families and children with hope that have HIV, provide care and treatment services. We are committed to seeing our mission through of ending pediatric AIDS. We had a number of sideload systems, and depending on which system you went to get your information, you got a different answer. That was not sustainable, especially as we were growing. We had very rapid growth. And during that time, we needed to figure out how to reconcile our information manually. It was very challenging. It took a lot of time. And there was a lot of room for error, as you might imagine. So as a nonprofit, we have to charge our donors for the staff and their salaries that when they were working on their projects. That process requires us to log all of the time that we work to the various projects that we work on. And that time has to be associated with your salary and then allocated appropriately to the right donor. We had to do that manually. And so it took a lot of time, it took a lot of people. And now with using Unit4, we just press a button and that's done automatically. We have our timekeeping system and our single source of truth for our finances, our project information all in one place. So we have to run a process and the salary allocations are done and we are clear on what the appropriate amount of monies are to charge out to our donors. We are in a cloud-based Unit4 system on ERPx, and we have staff that are in really remote areas. They are not able to connect to the internet always. They're not able to get into an office, but they can use Unit4 from their phone. It's really has helped us in that capacity. They're able to get the information that they need quicker. They can, for example, we used to have staff that would travel out to our remote areas and record our staff time every month. Well, we don't need to do that anymore because we have the ability for our staff to use their phone just to log in their time. Having all of our data in one place is extremely helpful for our country programs on the ground because they can understand what the entire financial scope of the organization looks like versus just their singular view in their country. This is helpful for growth, for example. So if we are looking to grow in particular countries, it can generate new ideas. It can generate cross-functional teams. It can generate just further conversation on what we can do to reach more people. As we are facing a lot of uncertainty and a lot of funding pressures, having reliable data is critical. Knowing that the amount of money that has been obligated to us is properly stored in our system allows us to properly plan for our future. And as we make proposals to other donors, there's a lot of times where we have to answer questions on how much money do you have, or what is your forecast, or how can you, what is your sustainability plan? How have you been impacted by all of the foreign aid cuts? And we're able to do that by extracting the information out of Unit4 and knowing that that information's right. We continue to look for ways to be more efficient. And one of those ways is utilizing AI. It is new for us. It is a little overwhelming, to be quite honest, but we are using Unit4 to help us in that effort. We know that the AI technologies in Unit4 are growing, and we are looking at how we can utilize that in a way that is going to make us stronger, that is going to make processes easier, and will help us reach our mission as quickly as possible. The sort of wow factor of Unit 4 for us is how robust the system is without being overwhelming and complicated. There are a number of different processes that we run through this system that are specific to very small teams. And we're able to manage that for those teams, but roll it up into something larger. We're able to manage our country programs as individual countries, but also as part of our larger organization. And thanks to Unit 4 ERPx, when we went live with our system, we were able to deprecate 5 other systems, and we were able to save hundreds of thousands of dollars in our first year alone. And thanks to that, we're able to redeploy that money elsewhere to help us fulfill our mission of saving lives.